Hi everybody, I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. Today I want to speak to you about a topic that's not sexy, it's not fancy, it's not flashy, but it's so important, and that's high blood pressure, also known as hypertension. It affects nearly half the adults in the United States. Now, approximately 90 to 95% of the cases in the United States are classified as primary or essential hypertension. In other words, we don't know the cause, while 5 to 10% are classified as secondary hypertension. And that has a cause. Like, for example, do you have a tumor of your adrenal gland called a pheochromocytoma or an aldosteronoma, which produces a hormone? And if we resect those, your high blood pressure can go away. Is there a blockage in the artery that supplies blood flow to the kidney, which causes it? And if we do an angioplasty or surgery, it'll go away. But the main point is that most of the cases are primary or essential hypertension, and there just is no known cause. So what are the potentials of untreated hypertension? Well, they're substantial and include increased risk of cardiovascular disease events such as heart attacks, heart failure, cardiomyopathy, ischemic and hemorrhagic stroke. Hypertension is also the leading cause of kidney disease and end-stage renal failure leading to dialysis, as well as vision problems called retinopathy and blindness. Recent research also confirms that high blood pressure affects brain health and diminishes cognitive function and causes dementia. High blood pressure damages the small blood vessels in the brain, which is linked to memory problems and long-term cognitive decline. The risk of all-cause and cardiovascular-specific death or mortality is significantly elevated in patients with untreated high blood pressure compared to individuals with normal blood pressure. The American College of Cardiology and American Heart Association highlight that high blood pressure is the leading modifiable risk factor for cardiovascular disease, morbidity, and mortality in the United States, and control is critical for reducing population-level adverse outcomes. So the good news is this week, a new joint guideline was released by the American College of Cardiology and American Heart Association. And this represents a much-needed update since the last guidelines from 2017. In my opinion, the most significant change was to revise the definition of what is considered high blood pressure. As a heart surgeon, we've been preaching to our patients that the systolic blood pressure, which is the top number, should be less than 120 millimeters of mercury, and the bottom number, which is the diastolic blood pressure, should be less than 80 millimeters of mercury. Well, finally, the non-surgical organizations have altered their thinking, God bless them, and realized what they've been preaching for so long was unacceptably high. The new guideline reaffirms the critical role healthy lifestyle behaviors play in preventing and managing high blood pressure and encourage healthcare professionals to work with their patients to set realistic, achievable goals. Specific blood pressure related guidance includes, number one, limiting sodium or sodium chloride or salt intake to less than 2,300 milligrams per day, moving towards an ideal limit of 1,500 milligrams per day. 2, following a heart-healthy eating pattern, for example, the DASH eating plan, capital D, capital A, capital S, capital H, and you can look it up, which emphasizes reduced sodium intake in a diet high in vegetables, fruits, whole grains, legumes, nuts, and seeds, low dairy, lean meats, poultry, fish, and definitely non-tropical oils. Coconut oils, no bueno. 3, ideally consuming no alcohol, or for those who choose to drink, consuming no more than 1 drink per day for men and 1 drink per day for women. 4, increasing physical activity for at least 75 to 150 minutes each week, including aerobic exercises such as cardio and or resistance training such as weightlifting. Most importantly, it emphasizes consider adding a medicine if there are no changes after 3 to 6 months of lifestyle changes. Okay, now a little bit about how you should measure your blood pressure. Well, obviously everybody's heard of white coat syndrome, and that's when you go into your doctor's office and your blood pressure is really high. Okay, so dismiss that. Well, you should get a blood pressure monitor, and a good one. Spend a little bit of extra money. And I tell my patients to measure your blood pressure first thing when you get up in the morning, before you have coffee, almost before you get out of bed. And then the last thing you do when you get in bed, measure your blood pressure and document it for a few days. And if it's sustained, it's real. And then you need to address it, okay? And I think that the best way to do this is if you buy a device and you're concerned because a lot of the over-counter devices overread your blood pressure, bring it to like a CVS or bring it to your doctor's office and match it up with either the big machine that they have at CVS, which is more accurate, or the old-fashioned, which is still the best cuff that they put on and pump up your blood pressure. Unfortunately, they don't have it in a lot of doctors' offices anymore. So I can't stress to you enough the importance of blood pressure control. Most people feel good until they don't, until they have a heart attack or a stroke. Okay, so with that, I know this isn't a fun and exciting topic in some crazy rare disease that is percolating around TikTok, but I hope you learned something today. I hope you take this seriously. Thank you so much for listening. I hope you have a great day. If you want more information, you can go to my website at www.paladinmds.com. And